My name is Mark Ricciardi, and I'm the Interventional Cardiology and Structural Heart Disease Section Chief at Endeavor North Shore Cardiovascular Institute in Chicagoland. Mitral valve repair using edge-to-edge repair devices is pretty well studied in various populations, but there's a very large population of patients who have gone unstudied. Those are namely patients with atrial fibrillation and preserved LV systolic function. So basically it's because there's a large patient population out there that the current trials have not yet looked at in detail, see what kind of benefit they may get from mitral valve repair. Yeah, so the study design is a prospective registry. So after the device was approved, registries were formed to assess the real world experience with the device. And essentially there are two prospective registries. One represented the most up-to-date use of the device to a certain point, whereas a new generation device with more sizes and shapes. So that second registry, called Expand G4, was combined with the first for this prospective registry we're calling Expanded. And the things that were very nice about this registry were that besides the fact that operators and centers would provide data for the registry, there was central adjudication of the echocardiograms. You can imagine that a central echo core lab was very helpful in determining the degree of mitral regurgitation, both pre and post procedure. So that was available in the registry and used. And there was also an events committee, a central committee that assessed the events of these patients. So not just self-reported, but adjudicated information. First, probably important to note that the mitral edge-to-edge repair procedure with the MitraClip device was exceedingly safe. So very low instance of heart damage and stroke and complications. So that's probably the first and foremost. And then, of course, we learned that we were able to reduce mitral regurgitation quite a bit. In this registry, we found that 95+% of people who underwent the procedure had reduction of their mitral regurgitation to 1+ or mild or less. So 95% reduction to just mild or less residual MR at 1 year. In addition, patients felt better. There was a quality of life survey. And so we know that patients felt better. They reported improved quality of life using the KCCQ. There were also less heart failure hospitalizations when you compare the number of hospitalizations before the procedure compared to after procedure. That was reduced significantly. We also saw some improvements in hemodynamics and LV size, which were important. Well, I think the main take home is that we have this very large population of patients with severe mitral regurgitation of atrial fibrillation and largely preserved LV systolic function. And now we have a very viable option to reduce their MR, to improve their quality of life, their symptoms, and lessen the chance they'll get hospitalized. I mean, we could probably talk about whether more study is required, but I think these real-world registries, although really valuable for us as practitioners and for the community at large, it doesn't randomly assign patients to different therapies. It's not controlled. For instance, the use of medical therapy in this population is an ever-moving target, so that wasn't controlled for. So I think that might add to this more preliminary data. I don't think we'll learn much about safety, but we may learn more about efficacy, certainly as it compares to a control group.